Bula Vinaka, and welcome to Bula Wellness. I'm your host, Dr. Alisha Sahu Khan, Head of Health Protection with the Ministry of Health and Medical Services. Communicable or infectious diseases used to cause the most deaths here in Fiji and around the world. A simple cut or wound would very likely become life-threatening for our ancestors, and many did not survive childhood. The average person was not expected to live beyond the age of 50. But this changed with the invention of vaccines, antibiotics, and with improvements to access to clean water, sanitation, and hygiene. So today, people are living longer. The average life expectancy in Fiji is 68 years, and deaths from communicable diseases have decreased to the point where only one condition in the top 10 causes of death in Fiji is caused by infectious disease, and that is lower respiratory infections. Despite this, we still have outbreaks of infectious diseases like dengue fever, leptospirosis, and typhoid fever. The World Health Organization continues to warn that we all need to be prepared for the next influenza pandemic, and new or emerging infectious diseases are considered the main threat to global health security, with the WHO in recent years announcing Ebola virus disease and Zika virus outbreaks as public health events of international concern. So to talk to us about infectious disease, today we have Dr. Ravi Naidu, who is an internal medicine consultant and infectious disease specialist at the CWM hospital. But first, let's see what some of you know about communicable or infectious disease.
What is communicable disease or infectious disease?
Communicable diseases, to me, measles and influenza. Communicable disease is disease that we catch from others in contact, like cough and flu, measles. What else? Does that include scabies and stuff?
TBs, and it can be cured, you know? Yeah.
So what are some of the things you can do to prevent infections or communicable diseases?
Well, stay away from people who are infected, and wash your hands before you eat.
Covering your mouth when you cough, sneeze.
Washing your hands after visiting the washroom
And before
having meals. Yeah.
First, we've got to live healthy. From the house, like we've got to sun our beddings and wash them weekly if they need be, and just eat healthy.
Like you can name a few measures put in place to fight against or to control infection diseases.
Some of the things I know, immunization in school and regular checkups.
Setting up advertisements on TV
Advertisements.
and signs on cafes.
In restaurants, and go to schools and get the students immunized, and some also go to communities to get the people checked up for future
General checkups.
Yeah, general checkups.
We are lucky to have governments think things for us, as for example, like educational level to this measure. So there shouldn't be any problem about this, because we've had so much educational program about this.
Welcome back. Our guest today is Dr. Ravi Naidu, internal medicine consultant and infectious disease specialist at CWM Hospital. Welcome, Dr. Ravi.
Thank you, Dr. Alicia. Thank you for having me in your program today.
So as you know, today we're going to be talking about infectious diseases. You're a specialist in infectious disease, so please just tell me a little bit about the work that you do.
I'm currently an internal medicine physician in CWM Hospital, and I have a special interest in infectious diseases. So I see a whole group of patients who have multiple medical problems, but I particularly look at patients with infectious diseases, and when there is an outbreak, I also give advice in terms of clinical management to the Ministry of Health.
Okay, so just for our viewers, in the Ministry of Health, I am an infectious disease epidemiologist. You're an infectious disease physician. So this means that I look at the disease of the population, looking at the trends, the outbreaks, whereas you are more focused on the individual patient. So what are some common infectious diseases in Fiji? What do you see most often?
In Fiji, we have the top three, the leptospirosis, typhoid, and dengue. These are the most common infectious diseases. But we also have a burden of TB, which is moderately big compared to other countries in the world. And we have other infections, other bugs which are quite common, such as Staphylococcus aureus and other multi-resistant organisms, which patients can be infected with. And there's also a significant proportion of patients who have HIV and have complicated infections as a result of HIV virus.
As I mentioned in the introduction, if you look at the top 10 causes of death in Fiji, there's only one that's caused by infectious disease, and that's lower respiratory infection. So essentially pneumonias. So you would also see a lot of pneumonias presenting to hospital, for example.
Yes, pneumonias are very common. It's one of the most common causes of admissions into the hospital. But fortunately, I have a good team who also share the load. So I don't see all the pneumonias. There's a lot of other physicians who also see and treat pneumonias because they're so common. On a given day, you might have 3 or 4 patients coming in with pneumonias into the CWM hospital.
So pneumonia, of course, is an infection of the lungs that you can get from viruses or bacteria or other organisms. Why are infectious diseases still a problem? If we made such big strides in the 1900s, to having vaccines and antibiotics, why are they still a problem today?
This is known as the double burden of disease. In particular, we are classified as low to middle income countries, where communicable diseases also, non-communicable diseases like diabetes, hypertension, and heart disease are a big portion of disease burden all over the world. But in Fiji and other low middle income countries, we have, because of our climate, our tropical climate, we have animals, and we have other things which spreads particular diseases like leptospirosis and dengue. So it puts us at a bigger burden in terms of communicable disease. And if you look at it internationally, there is a move against vaccination for some reason. I can never understand why that happened, but a lot of people are not participating in vaccination and immunization, and this has led to big outbreaks. In particular, a couple of weeks ago, there was a big outbreak in the US of measles. So that's one, that people are not participating actively in vaccines, vaccination of their kids and the populations. And one thing that has happened is the antibiotics, which were a panacea of infections, which was before the invention of antibiotics, people are dying of a simple cut or sore throat. But Alexander Fleming discovered the penicillin, which was the first antibiotic. Since then, medicine had changed markedly. Life expectancy increased, and we could treat simple infections with antibiotics. But what has happened in the last decade, there has been hardly any new antibiotics made. There are many reasons for this. But the bugs, the bacteria has become more vigilant and smarter, and they've become more resistant to antibiotics. So this is another reason why communicable disease has become a major burden in terms of disease in the world and in Fiji in particular.
And you mentioned vaccines. As I mentioned before, lower respiratory infections are the only infectious disease in the top 10 causes of death in Fiji. And we know as doctors that a lot of these deaths happen in children who get pneumonia. The Ministry of Health, of course, has vaccines against certain organisms that cause pneumonia. One is the pneumococcal vaccine and the Hib vaccine. So the fact that worldwide there seems to be a growing number of people who are against vaccines for non-medical reasons is very concerning, of course, to everybody who works in health and who knows the evidence.
Yeah, the vaccines.
They're one of our tools, along with antibiotics.
Vaccines, actually, what it does, it improves your immunity to certain diseases. So a lot of, I'm not sure what evidence people look at, but there's a whole following, like people jumping into the bandwagon and saying that vaccines are not good.
Yeah.
But doctors are people of science. I'm a man of science, and the evidence is there that vaccines work, and the evidence is there that we can save a lot of lives and save the population if we vaccinate. So it's a major thing that we must
talk a bit more about vaccines and the other tools we have to combat infectious diseases right after this break. So Dr. Ravi, before the break we were talking a bit about vaccinations. One of the common vaccines that we have, of course, is for measles, and measles is not new to Fiji. We recorded a massive outbreak in 1875 that killed about a quarter of our population, which was about 40,000 people at that time. So what would your advice be to people who are thinking about vaccines and their impact?
So the vaccines which are given to people of Fiji via the Ministry of Health, these are vaccines which have been proven to be effective and which are safe. So my children have participated actively with vaccination, and I'd suggest that it's a good way to prevent illness and protect the community. Because these communicable diseases pass from humans to humans. Some of them, if you protect a group of people through vaccination, you can prevent the spread. So something we call the herd immunity. So if somebody catches it because they're not vaccinated or immunized against a particular disease, then it puts the whole community or a whole group of people vulnerable to an outbreak. And as the movement against vaccination for people who don't have much knowledge and who are ill-advised do not vaccinate, you have a big group of people who are not immune to things such as measles, and when one person catches it, it spreads like wildfire. So it's not just individual immunity we want the whole community and the population of Fiji to be safe from outbreaks.
And of course, measles is one of our most contagious diseases, but it's becoming like another disease that is prevented by vaccines, polio, where less and less of our doctors are seeing it because we are so good now with our vaccines in preventing them that I think polio hasn't been seen in Fiji since the 1960s because of vaccination. And we're hoping that measles is going to go that way as well. I think the last case of measles we saw was in the late 2000s here in Fiji. The other, of course, the other tool we have against infectious diseases are antibiotics, specifically for bacterial infections. But of course, we're getting resistance to those antibiotics as well. Could you tell us a bit more about antimicrobial resistance?
So in the World Health Assembly for WHO, for the UN, there have only been 4 medical issues which have been brought up. So one was Ebola, the other one was HIV, and the NCD epidemic, and the fourth one is antimicrobial resistance. So this is an international crisis, I would say, and a big problem all over the world, and we are seeing our share of it in Fiji. So as what the antibiotics or antimicrobials do is they kill bacteria or fungi or viruses in our body. So taking medicines such as everyone knows amoxicillin or penicillin, it kills a particular bug in your body or bacteria in your body which causes disease. But the bacteria, they are living organisms, so they, I would say, outsmart. They want to survive as a colony.
So they get used to it.
They get used to it.
Resistant to the
They get stronger, so resistant to the antibiotic. And then there's a colony, so those resistant organisms, or bacteria, they multiply and they form larger numbers of resistant bacteria. So that has escalated, and even when Alexander Fleming first found penicillin, he said that this will happen. It was predicted. What has accelerated this is the overuse of antibiotics. Sometimes we use it when we don't need it, and the lack of production of antibiotics by pharmaceutical companies. So we are running out faster than what we are producing. And this is not an international problem only. We see a large share of this in Fiji too. So for people who are worried about antimicrobial resistance, I would like to just say, is when your doctor prescribes you an antibiotic, please do ask, why are you prescribing? Do I really need this? And you don't need an antibiotic for every illness. So.
And of course, finishing the entire course.
Yes,
Don't
yes.
stop taking the antibiotic when you feel better. Finish whatever the doctor has given you for the period that they've told you to take it for.
Yeah.
So of course, we've mentioned that some of our major outbreak-prone diseases are leptospirosis, typhoid, and dengue fever. We always warn about these diseases after the particularly rainy season. Our rainy season is usually from about October to April every year. In recent years, of course, with climate change, we've seen changing climate patterns with increasing amounts of rain or more frequent extreme weather events like cyclones. So could you talk to us a little bit more about the relationship between climate and these specific diseases, lepto, typhoid, and dengue?
I think in 2008 there was a leptospirosis outbreak, and there was a study done which looked at different amounts of rainfall and the number of leptospirosis. So it was mapped onto each other, and you could see like a very obvious trend where just after massive rainfall there would be a surge of leptospirosis. Even after Cyclone Winston, there was a big surge of leptospirosis, and the cases had risen. And now we have very irregular weather patterns, and at the moment in Suva we are having a lot of sunshine, a lot of rain. This is ideal environment for mosquito to breed. So we have stagnant water, and the temperature is quite warm. So mosquito loves this to breed. So unfortunately, so all this, the climate plus the current situation provides a good means of animals to breed, like mosquitoes. We have rats and other things, but I'll probably talk in detail later. The environment plus the temperature, the climate, it provides a good means for disease to spread. And so we have outbreaks of a lot of these diseases happening this time.
So we'll talk a little bit more about those climate-sensitive diseases and how to prevent them right after this short break. Welcome back. You're watching Bula Wellness on FBC TV. We have Dr. Ravi Naidu, infectious disease specialist, and we're talking about infectious disease. So Dr. Ravi, before we went to break, we were talking a bit about climate-sensitive diseases, which are also our outbreak-prone diseases. So leptospirosis, typhoid, and dengue fever. And of course, these infectious diseases, like a lot of other ones, can affect anybody of any age. Wherever you live in Fiji, you can get one of these diseases. But how does your lifestyle also affect your ability to catch these diseases?
It's to approach that, you have to look at the diseases in a bit of isolation. So leptospirosis in particular is spread by the urine of infected animals. So lifestyle for people walking bare feet or keeping cuts exposed. So the particular bacteria gets into your body through abrasions and cuts. So in your eyes, conjunctiva we call it. So people who go and swim in flooded areas and don't wear shoes, farmers who don't wear protective clothing. So this puts them at a higher risk of catching leptospirosis. Dengue in particular has to do with mosquitoes. So the most effective thing to do is to destroy breeding grounds for mosquitoes. So if you kill the mosquitoes, you prevent the spread of dengue. But the particular mosquitoes come out in what we call the twilight zone, so early morning and afternoon. Protecting yourself from mosquitoes in those times, wearing protective clothing and mosquito repellents decreases the transmission of this disease. And typhoid is just about hygiene, washing your hands. It spreads by infected feces or stool getting into food, so somebody has to ingest the infected feces to get that particular disease. Only way you can prevent it is wash your food well, cook it, and wash your hands. So those three things can also prevent typhoid.
So of course, washing your hands with soap and water.
Yes.
Making sure that the water that you're drinking is clean. So if you're in an area where there's a typhoid outbreak, for example, make sure you boil your water to kill the organisms. Huh? So I know a lot of the communication to the public from the Ministry of Health is around these lifestyle changes for leptospirosis, for typhoid, for dengue fever. So some of the common advice that we hear is don't walk outside with no shoes on, don't swim in flooded waters, kill mosquitoes, prevent yourself from getting bitten by mosquitoes, drink clean water, wash your hands after going to the toilet and before preparing food. So these are common things that go in terms of the advice that we give in preventing these infectious diseases. What about things like influenza, airborne diseases? Well, what can you do to prevent yourself getting those?
Influenza is, first of all, you have to look at the immunity of the individual. The immune system is a very beautiful thing. I think we all have a basic understanding that we have fighter cells in our blood. We have our own body protecting us from getting sick. So what we can do is just make sure you are strong enough to ward off and fight diseases. You can get vaccinated, that's one. The other thing is get a good diet, balanced diet with a lot of fruits and vegetables. Enough sleep, so 8 hours of sleep recommended. And stress is a big contributor to decreased immunity. And after checking all these things, if you are sick, you need to stay home so you don't spread it to other people. Again, hand hygiene is important. So if you touch someone who's sick, you wash your hands. And there's also masks available if you are sick, so you prevent the transmission of influenza. So those are the things, if done correctly, can decrease the transmission of disease to other people.
And of course, cough hygiene. So when you're sneezing or you're coughing into a handkerchief or a tissue, if it's a tissue, throwing that tissue away, washing your hands afterwards. So those are very important measures for preventing the spread of those respiratory diseases as well. We currently have an outbreak of leptospirosis in the Central Division. Could you just briefly explain what are the complications of this disease, leptospirosis? We know that the most common symptoms, of course, you get fever, you get body ache, you get headache. But what happens to the people who get very sick with leptospirosis?
Leptospirosis is a life-threatening disease. Life-threatening meaning we have patients who die of after getting leptospirosis. And leptospirosis remains one of the most underreported diseases in the world. So it's spread by a bacteria which is shaped like a spiral, and it enters your body, causes an infection. But the strange thing about this infection is you get better and then you get worse. So we call it a biphasic illness, where you have the fever, you get better, and then you have the immune phase, where most people die. So it's a life-threatening. We've had 4 deaths in this outbreak, and it is not a simple disease where you can do a blood test and say you have leptospirosis or not. It's a bit complicated than that. I think the public needs to understand that. And we've had training for the staff of Ministry of Health to increase their suspicion and to have a good diagnostic criteria, meaning to always think of leptospirosis because it's such a life-threatening illness in this outbreak.
And of course, a task force has been formed to look into the management of this outbreak, as well as the early treatment and referral of patients who are suspected to have leptospirosis. Unfortunately, time has caught up with us again, and that brings us to the end of this episode of Bula Wellness. I hope you enjoyed the program and learned a bit about infectious diseases and how to prevent them. If you have inquiries about the show or the topic today, like or contact us on Facebook, Bula Wellness FBC TV, or write to us at bulawellness@fbc.com.fj. Make sure to join us again at the same time next week. Until then, good night.